and nutrition. Please welcome Margaret.
And like every good exercise scientist, I have to have a prop and a tool. So like everyone else, I'm starting with a breathing exercise. So for this one, let's close our eyes or keep them open, your choice. And you're going to breathe in through your nose nice and slow for 4, 3, 2, 1. Now hold for a couple more seconds. And then let that out through your mouth for 4, 3, 2, 1. And let's hold for a couple more seconds here. So in that breath, there were 10 to the 22 molecules that went into and out of your lungs. That's a pretty big number, as you can see on the screen. And we did that pretty quickly and pretty naturally. So with that, unfortunately, a lot of our health information is not as quickly accessible. It doesn't come as naturally. It takes time for us to gather it. On average, it takes pharmaceutical research 17 years from starting research till the medication comes out. And it takes medical research between 5 and 7 years from start of research to being published. That doesn't even include it being adopted into practice. With that, we are in a race for improved health across the nation, across the world, yet it's taking us decades for this health information and health access to get to us. In that 5, 7, 17 years, who knows where you'll be? You might be driving or taking your self-driving hover car to a kid's graduation, or maybe we still have some slow Wi-Fi issues and we're dealing with that. But also in that time, you might silently be developing a chronic disease. Chronic diseases, probably you know someone who has them. They're things like type 2 diabetes, heart disease, COPD, hypertension. And often we don't know that we're developing them until the symptoms have progressed to a point where we can't really prevent it anymore. They are requiring a lot of care, many doctor's visits, medications, and they're impacting our daily lives. And research states that 70 to 90% of chronic disease is influenced by our environment. So the things around us, the things we take in, the things we interact with. Yet, I'd like to challenge this. While I don't disagree that 70 to 90% has some environmental influence, I'd also say that a lot of what we do internally and our choices that we make also impact our health. So to talk about this more, I'd like to talk about a class that I'm currently teaching. So in this class, I have a number of participants. I teach them for 4 hours a week. Well, 2 classes, 2 hours for each class a week. One of my participants, her name is Nancy. She is taking this class. It's a Tai Chi-based balance program. And 2 to 3 sessions in, so only a couple hours into the class, with only learning 3 forms, which I'm going to be goofy and demo them right now, but we just knew hold the ball, so we're just shifting our weight back and forth, or parting the wild horse's mane, so we're reaching a little bit, moving back, shifting that weight again, or single whip, so we're moving and shifting our weight to the side. She told me that on a day trip that she took with the senior center, she was able to prevent herself from falling. So for anyone who has had a family member who's fallen, or maybe has experienced it themselves, that can be a life-altering effect, especially for an aging adult. That fall can lead to broken bones. It can lead to ultimately their death over a short period of time. So for her to be able to tell me that she was able to get herself back to the bus without falling was huge. And it really made me wonder how, with 3 hours of practice, how did this happen? How did this little bit of insight help her move safely? And for me, I quickly realized between that and thinking about some other things, it was that this exercise program is based in corrective exercise. So what is corrective exercise? It is not our heavy lifting in the gym that most of us think of when we think of exercise. It's a part of our exercise that is more like physical therapy, so things that are working on muscle, balances, posture, balance, range of motion or mobility, and overall what's important to our functioning in daily life. And it doesn't always seem fun. It's using those small muscles that in our body we need to strengthen to keep upright, to keep our lives moving smoothly, but we often choose to neglect those areas of our bodies. For this, I'd like to give some examples from some clients I work with on a regular basis. So one of them, she is a recreational rock climber, more recently at least, but she came to me about a year ago with chronic knee and back pain. This chronic knee and back pain sidelined her as a distance runner and left her kind of lost. She's like, I've been running all my life and I can't do it anymore. I don't know where to go with this. And then to add on to that, she loves to rock climb. She's often at the climbing gym, but these back pain and knee problems were also resulting in her not being able to do that activity she loved either. So we started with corrective exercise, things that strengthened the muscles around her joints, that worked on stability, and while she's not able to run just yet, she's decided she's going to stick with rock climbing and biking still. Her pain has decreased, her strength has increased, and overall, she's now able to notice if she's going to reach too far at the climbing gym and cause her back to hurt herself and go further than she can. Or let's think about, I work with an 8-year-old. This 8-year-old came to me because her family was like, we just need her to have better movement patterns. We're worried about her safety. She had an injury as a child. She favors one side of her body as a result. And we want her to be able to move safe, to be active, and to develop good patterns long term. This child we started, she couldn't stand on one foot, at least not for very long. Or try sitting down to a chair. We all do this on a regular basis. She struggled to do that motion. In about 5 weeks of time, we're now standing on our BOSUs, throwing balls, playing catch, you name it. No thought, just having fun. And while she's doing that, she might be having a blast, but she's also working on her stability muscles, her coordination. Sometimes she calls it her surfboard, and she calls the shots, and we're all on one leg, her brother included. And she's not realizing that she's developing healthy movement patterns and creating a lifetime worth of good health for herself. With all of that, it is so important for us to think about the importance of those stabilization muscles. When I stood on that BOSU there, I was probably using a dozen or more muscles to stabilize myself and keep myself up there. But often, things like that, they take practice. It takes time to develop that stability. And we all start somewhere. But we can all make a small effort every day to start somewhere, to take a little bit of action to what can help improve our function. And with that, we also, to have stability, to be able to build those muscles, to be able to fuel those activities, we need good fuel. Our bodies need protein-rich diets to repair those muscles, to provide us energy. And while we also need to do the exercises, fuel the body, it is also in order to improve our health, it's our job to make choices with our healthcare decisions, to be aware of those questions and knowledge about our bodies. I think that Dr. Kalanithi says this best when he says that he began to realize that it wasn't just a doctor's job to have the answers. It was his job as a patient to ask the right questions. Too often in the healthcare industry, we rely on the doctor as the expert. And while they're extremely knowledgeable, if we're not asking the right questions, we're not going to get the answers we need. We're going to continue on, accept what they tell us, maybe make no changes. Or maybe, take the medication and then assume that that's going to help fix the whole problem. So it's our job to ask questions about our health. Things like, how will this condition impact other areas of my body over time? What are the long-term effects and side effects of this condition and the medications I'm taking for it? What medication-free choices can I try first? And for many healthcare conditions, there are medication-free choices that we can ask about or interventions we can make. And can you provide resources or reading in my native language to better understand? Health literacy is at the center of us having better health. And right now, fewer than 10% of Americans currently are considered health literate. So most of the American population has little idea about their health. This impacts when we ask questions at the doctors, if they can give us good, reliable information. even the filling out of forms or following the prescription bottle directions. And if you are not in a country where it's your native language, that becomes even harder and even more difficult to understand. So with all of that, often when we get to a point where our goal is always prevention, but if we get to a point where it's no longer preventable, it's often too late, unfortunately. We have to treat what we can, mitigate the symptoms, make better choices, but still, if we can prevent it early, it's best. So as Dr. Kalinithy says, it's not until we face the reality of our mortality that we fully understand the importance of caring for our bodies. It is vital to care for our bodies, to make good choices for it. And as college students, most of you are at a pivotal point in your life. You're free from your parents, you get to make your own decisions. I remember that time, and often, instead of thinking about what good habits can I create now, when it's easier to make good habits than to break bad ones later, you go for the instant gratification, the TV dinner, the Taco Bell, the Saturday Borgs, the multiple all-nighters in a row to study for your finals. And I get it. I didn't do it perfectly either, but I did try to make an effort about good health for myself. I was selective about what I ate, when I socialized. I often prioritized sleep, and as a result, my fitness level improved. I went from being a slow cross-country runner in high school to, I did not end up walking onto the D1 team, but I could have when I was elsewhere, to my fitness level increasing now and being faster than I was as a collegiate age runner. So with all of that, I'd like to remind us that similar to breathe this all in, and similar to the wind outside, our breath, our health is vital, and we often take it for granted, so let's not let it blow away like a gust of wind. And thank you.